I'm Dr. Paul Everall. I'm a reader in archaeology in the Faculty of Humanities and Social Sciences. My role is primarily lecturing, teaching. I teach undergraduate students and taught masters, and I supervise PhDs. So at school I was always really interested in history, and I had an opportunity to work on a training excavation at Roxeter in 1989, and I loved the hands-on aspect of archaeology and the practical engagement with history. I like to think that archaeology is a fairly unique form of applied sociology, and I think we're interested very naturally in people, and most archaeological work focuses on past societies, but I think we're also very interested in contemporary society as a discipline. So the relationship between veterans and archaeology was established in 2011 with the Operation Nightingale initiative that was established by the MOD. And like a lot of archaeologists, I was inspired by the benefits in terms of well-being and mental health that were being reported. And through that, I wanted to explore ways in which the department here could contribute to that work or build on it, and that's really where it started. Archaeology is a really interesting subject academically. It's quite unique. There's the tangible engagement with the past, which I think is really powerful, not just in terms of mental health and well-being, but in terms of general interest. The opportunity to handle an object that's been dropped or lost or broken maybe thousands of years ago, and that relationship with people of the past I think is really quite powerful, potentially therapeutically. But there's also the working outdoors is a really positive aspect anyway. The camaraderie that you naturally get in a team-based working environment I think is really powerful and positive as well. So there's lots of magic ingredients that make archaeology really quite powerful.
I'm Dr. Karen Bunnell. I'm an Associate Professor of Applied Psychology at Southampton Solent University. Over sort of the past decade or so, archaeology had been used as a vehicle to support veteran mental health and wellbeing. But at the time, there wasn't really anyone in the sort of the psychology, mental health space to be guiding and supporting the work that was being conducted. And so I was invited by Dr. Paul Everall of University of Winchester to provide that expertise.
In terms of the veteran studentships, that emerged out of conversations that I was having with Richard Osgood at the MOD and Giles Woodhouse, who was then at Help for Heroes. And we were trying to find ways in which we could support the Operation Nightingale initiative academically. And it was a fairly kind of ambitious pitch, I suppose, to senior management to offer fee waiver studentships for veterans who discovered a love of archaeology through Operation Nightingale and the other initiatives. And I was very pleasantly surprised that senior management gave us the green light, and we've had veteran studentships coming through ever since. So the AMFRA guidelines are very much part of this work, maybe the next step. So it stands for Authentic and Meaningful Participation in Heritage or Related Activities, and they're best practice guidelines drawn up with stakeholder input in terms of what's best for participants in terms of safely delivering mental health benefits, but also what's best for the historic environment. Archaeology is a destructive process, so we have to be careful from that perspective as well. And the guidelines provide a framework that project providers can follow to make sure they're adhering to best practice.
The guidelines are there to support all projects, and the projects really don't focus on specific mental health needs. As I say, what they're doing is they're providing a safe place, a trusted environment in which people can engage in activities that help them to feel better in themselves.
In terms of key achievements, well, we had graduation recently, and one of my most recent veteran studentship holder graduated, and that's always a really emotional moment to see someone perhaps who felt that the university was never going to be within reach achieve great results and graduate. That's a real achievement. And talking to some of our previous veteran studentship holders, I'm told things like, before I was a veteran who had an interest in archaeology, and now I'm an archaeologist who happens to be a veteran. And that sense of transformation is really, really powerful, I think, real sense of achievement through that. a number of our studentship holders who have graduated are now working in archaeology and loving their new career, which is wonderful. We've also hosted Ukrainian and Georgian and UK veterans on the site I co-direct in Georgia, and bringing veterans of different backgrounds together, even with language barriers. The achievements there, the sense of kind of brotherhood was really powerful. In terms of the future, I very much hope that the university will be able to continue supporting the studentships. I think they've demonstrated how powerful and effective they are. The AMFRA guidelines, we are in conversations with a number of organisations in terms of implementing them to support best practice. And personally, I think, and you know, my collaborators and I share the belief that they can form a kind of quality assurance kind of kite mark for projects that are aiming to deliver mental health and wellbeing benefits. So that would be you know, the target.